And with that, I am going to introduce Emma Boucher, our Technical Assistance Coordinator, who will be leading us through the presentation.
Thank you so much, Hannah, and welcome all. We are so happy to have you here. As Hannah said, my name is Emma Boucher, and I'm going to be walking us through some big federal changes coming to MassHealth within the next year. And without further ado, we're going to get started. So, we are really going to be talking through kind of the big questions about these changes. And the changes we're focusing on today are work reporting requirements and 6-month renewals. So, we're going to be diving into the who, what, why, when, where, and how of these changes. All right, so last summer, Congress passed President Trump's sweeping signature tax bill called the One Big Beautiful Bill Act. This bill has many names, including HR 1, Working Families Tax Cut Act, the Budget Reconciliation Act, but to keep things simple, we are going to be referring to it as OB3. Now, OB3, for our purposes, what's important to know is that it included the largest cuts to Medicaid ever. So, this limited both funding for the program as well as who can qualify for the program. And just a reminder, in Massachusetts, Medicaid is called MassHealth. Medicaid is paid for by both the state and the federal government. So in Massachusetts, the federal government covers about half of all Medicaid spending. MassHealth has to follow this new rule, or Massachusetts will lose this federal funding, which would be really significant to the state. All right, so let's get into the first big change that is coming down the pike. So this is work reporting requirements. Very simply, this means that you are now going to have to prove that you are working in order to receive benefits. So, some things to know about work reporting requirements. They're not new necessarily. Public programs like Transitional Aid to Families with Dependent Children, or TAFDC, and SNAP, which used to be called food stamps, have had work requirements for about 30 years. And states like Arkansas and Georgia have had Medicaid work reporting requirements in the past. What's very important to note, though, is that these requirements don't really work. They don't result in more people having jobs or being employed, and they're very expensive to implement. They really just create red tape and roadblocks, both for the members themselves and also the state who is implementing them. So, what are the specific work reporting requirements in OB3? In order to keep their coverage, MassHealth members are going to need to do at least one or a combination of the following. So the first option is members can work, volunteer, or go to a job training program for at least 80 hours per month. So a job training program can include things with mass hire, apprenticeships, work trainings, etc. The second option that members can complete is to attend an educational program, at least part-time. And that can include GED classes, college classes, etc. And the final option is that a member can earn at least $580 per month. So this one is the trickiest option. So the $580 per month comes from the federal minimum wage times 80 hours per month. This does not necessarily need to be earned income from a job. So, for example, if you receive an inheritance payment or a welfare payment, that would count towards the 580. It's also household income. So, for example, if one spouse earned $580 per month and the other did not work and earned $0 per month, both would still be compliant for the work requirements because their household income earns $580 a month. And finally, this $580 per month can also be an average for seasonal workers. So if a seasonal worker makes an average of $580 per month over the course of a year, they would be compliant with the requirement even if they did not work all 12 months of the year. Now, how are MassHealth members going to verify that they are meeting these requirements? First, MassHealth is going to use data it already has access to try to verify that a member is meeting the requirement. So, this will include member information like age, household makeup, disability status, income. They'll also look at past insurance claims, payroll data, and then data from other state agencies. And that's going to include agencies like the Department of Mental Health, the National Student Clearinghouse, and MassHire. If MassHealth still then does not have enough information, members may need to provide other information like pay stubs, proof of enrollment in an educational program, like a transcript, volunteer logs, or medical records. So, who is going to be affected by these work reporting requirements? The very short answer is Medicaid expansion adults. What does that mean? So, under the Affordable Care Act over a decade ago, Medicaid was expanded to include low income childless adults. And so these are adults ages 19 to 64 who make up to 138% of the federal poverty level. The federal poverty level, or FPL, is a measure of income used to see who can get on different public programs. It's important to note that these adults cannot get mass health coverage for any other reason. So, for example, they wouldn't qualify for being disabled or pregnant. This is really their only pathway to qualify. In Massachusetts specifically, many expansion adults in this category are on Mass Health Standard or Care Plus coverage types. All right, and now we are going to get into some examples. So, first we have our friend Jane here, and Jane is on MassHealth Standard. She takes 6 credits per semester at Bunker Hill Community College, and she works 10 hours per week at Duncan. So, she is our classic Massachusetts resident. So when we're thinking about if Jane meets the work reporting requirements, there's a few things that we can tick through. So first, we know that Jane is on a Mass Health plan that covers Medicaid expansion adults. She's on Mass Health Standard. We also know that she is in school, so she's taking part in an educational program. And the way the federal government is classifying time for education is that 1 credit equals 3 hours of work. So she's taking 6 credits. That means she's working 18 hours-ish a week on school. We also know that she's working at her job for 10 hours a week. So does Jane meet the work reporting requirement? And our answer is yes, she does. So she has her 18 hours a week of an educational activity plus 10 hours of work a week, which equals 28 hours per week. And then that equals roughly 112 hours per month, which is over the 80-hour per month threshold for meeting the work requirement. Next, we have David, our goofy farmer here. And David is on Mass Health Care Plus. And David is a seasonal worker. So he works from April to October on a farm, and he is earning $1,000 per month. And he doesn't work November to March. So when we're asking the question of if David meets the work reporting requirement, we have a few things again to kind of tick through. So first, we know that he is on a Mass Health plan that covers expansion members. We also know that he earned almost double that $580 compliance threshold in some months, but $0 in other months. So does David meet the work reporting requirement? And again, the answer is yes, he is compliant. And the reason for this is again, seasonal workers need to earn an average of $580 per month across 12 months. So David earned about $7,000 this year. $7,000 divided by 12 is $583 a month, which again, on average, which is above the compliance threshold. So David does meet the work reporting requirement. Now we're going to be getting into the other who, which is who will be exempt from these work reporting requirements. Who is not going to have to prove that they are working in order to keep their coverage? First, we're going to go through the exemptions that are going to be pretty clear cut. And they're probably going to be the most common as well in the people that you serve. So, first, we have children under 19, adults over 64, people with disabilities, people enrolled in Medicare Part A or B, people who are pregnant or postpartum. And it's important to note that pregnant is regardless of the outcome of the pregnancy. So you would get 12 months of coverage after the end of the pregnancy, and be exempt for the same amount of time. Parents of children 13 and younger, and caregivers of children 13 and younger or a person with a disability. So, just to note, as a kind of technical aside, families on MassHealth Standard who make up to 133% of the federal poverty level, who have kids ages 14 to 18, will also be exempt. And then caregivers of a child under 13 or a person with a disability, that can either be a family member who lives with the child or a person who does not live with them but still spends a significant amount of time caring for them. These exemptions on this slide are a bit trickier and they may also be less common in the people that you serve. So, first, we have subject to SNAP work reporting requirements. And the reason for this is that the population who needs to meet SNAP work requirements is the same population that is going to need to meet Mass Health work requirements. So, if you're exempt from them for SNAP, or if you're meeting them for SNAP, you would be exempt from the Mass Health work requirements. It's a similar situation for a TAFDC. So if you are meeting the TAFDC work reporting requirements, you would be exempt from the Mass Health work reporting requirements. Again, because you've already demonstrated to the state that you are complying, so you won't need to do it twice. Next, we have former foster youth under the age of 26. Veterans with a total disability, and that just means the VA gives disability ratings for veterans, and total is one of those ratings. We have incarcerated or recently incarcerated individuals, and recently incarcerated is 90 days after release. And then we have Indians or urban Indians, and that is a federal government designation that determines Indian or urban Indian status. Finally, we have our most complicated exemption, which is medical frailty. And so, medical frailty can simply be defined as a serious and complex medical condition, but the key is that the condition has to prevent the member from working. Even if you have a serious or complex condition, if you can still work with that condition, you will need to meet the work reporting requirements. Unfortunately, at this time, there's no list of conditions or medical codes that will always exempt a member on grounds of medical frailty. And we are unfortunately expecting that providers or doctors will need to be involved in deciding this exemption. Medical frailty does include substance use disorders, and that is up to 5 years of being in recovery. And you don't necessarily need to be actively in a treatment facility or in treatment to count as having a substance use disorder. And it also includes behavioral health conditions. So, again, these would need to be serious enough to prevent a member from working. All right, now we have some exemption examples. So first we have John here, and John has HIV, but he's managing his condition with medications and has no complications. He is a single adult with no children, and he is on Mass Health Standard. So will John be exempt from work reporting requirements? Let's think about what we know. We know that HIV is a serious and complex medical condition. We also know that John can't be exempt from being a parent or caregiver because he's a single adult. And we also know that John is on a Mass Health plan that covers Medicaid expansion adults. So, will he be exempt? Unfortunately, the answer is no. He will have to comply with the Mass Health work reporting requirements. And that is because even though his condition, HIV, is serious and complex, it doesn't prevent him from working. So unfortunately, he would need to still comply. Next, we have Maria. Maria has a 4-month-old baby. She is married and she is on MassHealth standard. So, again, when we think about the facts of her case, we know that she's 4 months postpartum and she's on a MassHealth plan that covers Medicaid expansion adults. So, will Maria be exempt from the work reporting requirements? The answer is yes. She is still within the 12-month postpartum coverage period, so she would be exempt. Until that baby is also 14, she would be exempt because she is a parent. So, yes, she is exempt from the work reporting requirement. All right. How is MassHealth actually going to implement these work requirements? So, for new applicants, people applying for the first time, they are going to need to prove that they either met the work reporting requirement in the month before their application or that they did not have to meet the work reporting requirement because they were exempt in the month of their application. So, for example, if I applied to MassHealth this month in August, I would either need to prove that I met the work requirement in July or I was exempt from the requirement in August. Unfortunately, if someone can't prove either, their application would be denied. For current MassHealth members, this is now going to be baked into the MassHealth renewal process. So first, MassHealth is going to use past claims and other member data to try to auto-renew the member. So to try to automatically check if the member meets work reporting requirements or is exempt and doesn't have to meet the work reporting requirement. And this will take place at each renewal. Very important to note, and we will get into this on the next slide, renewals are now going to be processed every 6 months instead of every 12 months. After trying to auto-renew the member, if that doesn't work, MassHealth will send a renewal form to the member if they can't verify using information they already have. The member will have 45 days to complete this renewal form. If the member still can't prove, or if MassHealth still can't verify that a member is following the rules after receiving the renewal form back, MassHealth will mail a request for information to the member. And the member will have 30 days to submit proof to MassHealth to show that they are meeting the work reporting requirement or that they are exempt from the requirement. If the member still does not do so, unfortunately, they will be removed from MassHealth coverage. Okay, so the second big federal change that I alluded to is that Medicaid expansion members, so again, these low-income adults ages 19 to 64 who make up to 138% of the federal poverty level and can't be on MassHealth through any other pathway, they are now going to need to renew their coverage every 6 months instead of once per year. And this is going to begin in January 2027, and it's going to coincide with the member's renewal date. Unfortunately, there are less exemptions for 6-month renewals than there are for work reporting requirements. So the only exemptions for 6-month renewals, and who will still be able to renew every 12 months, children under the age of 19, adults over 64, people with a disability, pregnant or postpartum members, parents or caretakers of a child under 13, or Indians or urban Indians. And so, because there are less exceptions for the 6-month renewals than for work reporting requirements, members of the same household may be on different renewal timelines moving forward. Just to reiterate the renewal steps from the previous slide, first, MassHealth is going to try to auto-renew members using information they already have. If they can't auto-renew, MassHealth will mail the member a renewal form, which members will have 45 days to complete. And then, if needed, after receiving that renewal form back, MassHealth will mail a request for information to the member to verify that they're meeting the work reporting requirement. Members will have 30 days to respond to that RFI. Just to note, for other requests for information, such as income verification, members will still have 90 days to respond to those requests for information. So there is a difference in timing. And now we have a 6-month renewal example. So here we have MassHealth member Sabrina, who's on Care Plus, which is again a MassHealth plan that covers many expansion adults who are going to be affected by these 6-month renewals. Sabrina's coverage spans from February 1st, 2026 through January 31st, 2027. MassHealth is going to renew Sabrina's coverage for February 1st, 2027. So when is Sabrina's next renewal date going to be? The answer is August 1st of 2027. And that is because it is 6 months after her first renewal date in 2027. All right, and finally, when will these changes go into effect? The answer is January 1st of 2027. MassHealth is actually currently sending notices to members that began this month, just alerting them of these changes. And current members are going to be subject to work requirements when they're first up for renewal in 2027. So it'll be on a rolling basis. All members who need to meet work reporting requirements will also have to renew twice per year, but not all members who renew twice per year will have to meet work reporting requirements because of the different exemptions for each requirement. And what's next? Where do we go from here? So, Healthcare for All is running a work reporting requirements informational campaign. We are partnering with 47 community-based organizations around the state, and we are providing them with multilingual flyers and posters and social media posts, trainings like this one, and other resources and technical assistance so then they can help spread the word. We've also worked with MassHealth to develop the following website, so mass.gov/MassHealth member changes. And this member webpage is where members can go to find updates about these changes and other federal changes that are taking place to the program. It's also where our multilingual communications toolkit, so again, those flyers, posters, social media posts, that's where that lives. And finally, there's a really great screener tool on first when you look on this page, the first thing you see. And members can use this screener to walk through some preliminary questions to see if they may be affected by the work reporting requirements. And the most important thing you can tell people now is to update their information with MassHealth. Review their information. They can either call MassHealth, use their My Services portal, or work with an enrollment assister to help update that information with MassHealth. It's also important to remind members to read all mail from MassHealth. Because if you are affected directly by these changes, MassHealth will be in contact with you. They will contact you directly. And finally, MassHealth again is going to be publishing updates on their member changes website, so you can check that as well for resources. Also to note, the blue envelope is back and better than ever. If members receive a blue envelope from MassHealth, that means that they need to take action. There is a piece of information in that blue envelope that they will need to respond to. And that concludes our presentation. We're now going to switch to the question portion of our webinar. I'm going to stop sharing the screen, but I will put both my email address and Hannah's email address in the chat or the question box so that